This was their hospital, and they personally saw it as their hospital, and that really made a difference. I think the difference is when you have that ownership feeling, even though we aren't owners, you can't own a nonprofit. I think it makes a difference in how you approach your work every day. There was the buy-in, there was the actual sense of, I think, ownership that made a difference with patient care for us. And now we've moved into what can we do in the community to actually prevent disease? How can we make people healthier both mentally and physically? So we've gotten involved with worksite wellness and also the Cass Clay Healthy Initiative, which really is looking at how do we look at a population in our community to try to improve their health over time. And from kids in daycare all the way up through the elderly. It really starts at a young age, and we've had a real focus on the schools. And we think in the long run that's where the biggest bang for our dollars is not trying to take care of people after they're ill, which we did when we were a hospital only, is to improving the health of this community and moving forward with it. Really making Fargo-Moorhead area and our region some of the healthiest people in the country. You know, we've also looked at the availability to have nurses and physicians in North Dakota, and so we've had initiatives to try to improve the availability of nursing, which has been difficult in the past, and also looking at primary care. They're kind of the basis for chronic disease management. So as the population in North Dakota ages, we've taken a proactive step to try to ensure that we have primary care that are grown here in North Dakota, that are trained here in North Dakota, and are most likely to stay here in North Dakota. An emphasis for us has been children, and one of our recent programs has been screening for mental health illnesses so we can address that early on and correct some of the things before they ever get to school and at a later age where they can be much more expensive to take care of, and you've lost that ability then to help these kids at an early age. You know, we're always looking for innovative ways in order to leverage our money. One of them that comes to mind is certainly our association with the Impact Foundation and the Giving Hearts Day. So the way we've partnered with our other nonprofits that we're not competing with, we want to elevate them to a higher level. We want to allow people in this community to be generous, which they have. And so programs like Lend a Hand and Giving Hearts Day is such a blessing to see the people here that will give if they have something of value to give to. This is a wonderful board to work for. It's a wonderful staff, and I think that's probably the greatest thing. I think we really feel like our integrity, the value we produce for this community is first rate. So it's a great program, and I've got a great staff I've worked with and a great board I've worked with. And it's just been enjoyable to do that.